Good day, everyone, and thank you for being here. The purpose of today's event is to answer questions from our group in the gluten-free course, the 30-day course that we're doing. And then after I've answered their priority questions, if there's time afterwards, I'll answer as many questions from the viewing audience that's here today as possible. And I'd like to start by giving you a few slides. I want to set the stage for what we're doing here for everyone, especially for our students in the course. And this is what I'm preparing for a presentation I'm doing shortly. Let's see, let me share screen here, do that. There we go. And then I have to get that little box out of the way so that I can get to my presentation mode. There we go. Boom. So I'm hoping that as you hear this information, that it's a little surprising for you and that it encourages you to jump in, to really dive into the unknown in what people are not being taught right now that is so critically important to understand when you want to be healthier. You've tried some things, they've helped a little, maybe not enough, and you want to be healthier. So let's get started. What's the most prevalent pathology at the root of practically all disease? And this is the million-dollar baby in the room, that it's inflammation that dominates present day morbidity, which means getting sick, and mortality, which means dying. Around the world, it's inflammation. Chronic inflammatory diseases have been recognized as the most significant cause of death in the world today. You know, we're all going to die at some point, hopefully much later. But when we do, when our time comes, it's very likely to be from a chronic inflammatory disease. And the Center for Disease Control tells us that 14 of the 15 top causes of death are chronic inflammatory diseases. The only one that's not is unintentional injuries, accidents. That arrow went down a little too far. It's supposed to be on number 3. Unintentional injuries. That's the only one that's not a chronic inflammatory disease. Everything else is a chronic inflammatory disease. And inflammation, just by definition, what inflammation is, it's the response when your immune system gets the message that we're under attack. Fight and defend. That this is how we survive. Inflammation is not bad for you. Excessive inflammation is bad for you. And so we always want to avoid those exposures in our world that trigger more inflammation. That's the big kahuna in the room. And I love this one because these scientists are already telling us that there's a balance in the intestines, that when it's knocked out of balance, it compromises both the function and the integrity of the gut and causes low-grade systemic chronic inflammation. I'm not going to go into a lot of detail today about that whole mechanism, but for now, just know, and there's lots of science to this, that if there's only one thing you're going to work on to be healthier, it's having a healthy gut, a diverse microbiome, lots of different types of the good bacteria. Not so much of the bad bacteria. You know, we always have some, but not so much. And that's the goal. That's the big goal for health and longevity. And I love this slide because it gives the visual that if systemic chronic inflammation is the cause of death, for 14 of the top 15 causes of death is systemic chronic inflammation, we want to understand, where is it coming from? And this drawing does it so well that the wheel in the center, it represents inflammation. Well, where does it come from? It comes from everything on the left. which is chronic infections, bacteria and viruses, physical inactivity, obesity, an abnormal gut, too many bad guys, not enough good guys, the foods that you eat, too much stress hormones being produced from chronic stress, sleep not being rejuvenating for you, and then chemicals we're exposed to. Those are the major ones, and they turn that center wheel. And when the center wheel turns, then depending on where the weak link is in your chain, you pull at a chain, it always breaks at the weakest link. And that's determined by genetics and how you've lived your life. They're called antecedents, meaning you eat tuna fish 2-3 times a week, you likely have mercury toxicity because tuna's got mercury in it. So that's an antecedent. So it's your genetics and your antecedents that determine where's the weak link in your chain. And it's the inflammation that pulls on the chain. So it doesn't matter if you've got diabetes or non-alcoholic fatty liver disease or cardiovascular disease or cancer or depression or anxiety or autoimmune diseases or neurodegenerative diseases. It doesn't matter. The mechanism is the same. So you always want to include in your protocols a primary emphasis is, how do I reduce the systemic chronic inflammation in my body? And shifts in the inflammatory response from short to long-lived inflammation, a short, quick response because you're exposed to a bug. Well, your immune system gets activated, creates the inflammation to kill the bug. That's a good thing. But then if your system doesn't calm down, you shift from short to long-term inflammation, and it leads to major alterations in any and all tissues and organs. Because the inflammation, those molecules of inflammation are in your bloodstream, and your bloodstream's just a highway. It's all going in the same direction, but it's just a highway. And there's no lanes of traffic, everything's bouncing into each other, but it's just a highway. And the more inflammation molecules you've got in your bloodstream, they pull at the chain wherever your genetic and antecedent-based weak link is. That's the million-dollar understanding to have before we talk about our specific topic today. And understanding inside the body and outside the body triggers, environmental triggers that foster chronic inflammation provides important insights into why people get inflammation-related diseases, and there are those that don't. We have all heard stories of the person that goes to sleep one night and just doesn't wake up at 88 years old. Peacefully dies in his sleep with a smile on his face. That's a whole lot different than having a stroke and for 6 years you're crippled trying to move around. So the chronic inflammatory diseases, our goal is to reduce the risk of having chronic inflammatory diseases. And you do that first by identifying the big triggers on the left side of that drawing of the wheels. And then second, identifying the the long-lived mild inflammation that we get. So when we think about inflammation, it's the chronic low-grade inflammation that's characterized by long-term unresolved inflammatory conditions that most people don't know about because they feel fine, they feel okay, but they've got chronic low-grade inflammation. And there's a drawing here. Well, I put this in here. These are slides I'm going to be giving to a presentation I'm doing in a couple of weeks in Colorado. And if 14 of the top 15 causes of death are chronic inflammatory disease, what percentage of your patients presenting to you do you suspect have chronic low-grade inflammation? And it's every single one of them. They do, because nobody looks for this. So you get exposed to a bug, you get sick for a day or two. That's your immune system getting activated with acute inflammation to kill the bug, and then you're fine within a couple of days. But if you continue to have the chronic low-grade inflammation, meaning the red line, that's just continuing across your lifespan, across time, you have this chronic low-grade inflammation, and you may feel fine. There's no acute symptoms right now, but if that's going on, eventually that chronic low-grade inflammation, by definition, is killing off cells, killing off cells, killing off cells. Then eventually one day you get diagnosed, as patients used to come to me sometimes and they'd say, "Doc, I just came from my doctor, my internist, and I got the sugar. I finally got the sugar." Meaning their blood sugar had been out of balance for a long time, but they never worked on it. They never dealt with the problems. So now they've got diabetes. I got the sugar. So this chronic low-grade inflammation that's under the surface while you feel fine, but it's killing off cells, killing off cells, killing off cells until you've killed off so many cells. Now you get this response where your tissue doesn't work very well anymore. And this is the area that we really want to deal with. We want to look at what are the triggers for this chronic low-grade inflammation that doesn't make us sick at the moment. We can't tell they're going on, but this is a very advanced concept of where we want to focus our long-term education, is identifying the triggers that are causing this low-grade chronic inflammation. And we're going to talk more about it in the future, but I just wanted to introduce that concept to begin with, and we'll get to the questions, that have come in. And but that concept is so critically important when you want to be healthier. And I want to make sure that everyone that's coming through our programs, that they feel really grateful that they've learned a lot and they've got a bigger picture and now they know what they're working on. That's my goal here with this. So now I'm going to go to the questions that came in from our students who are in the course right now. And Ann will put a link here for the course to those of you that are guests here today. The first one. Dr. Tom, I was told that making your own sourdough bread using einkorn flour would be safe to consume. Is that the case? And I have to smile because my good friends who own and run the Swiss Mountain Clinic in Switzerland, the best place to go to in the world. They're just the very purest and the highest quality. They're really great. And Marzi, my wife, actually converted their kitchen to gluten-free a number of years ago. And Dr. Frederica, she's taking over the job this year. She sent me an email saying, "Dear Tom, I'm going to move our kitchen more in the direction of fermented foods," which is really great. The more varieties of fermentation that you do, the better you build the gut microbiome, the more diverse the microbiome, because every vegetable that ferments produces different families of the good bacteria. So you don't want to just eat sauerkraut. You want to have some sauerkraut, some kimchi, some miso, some fermented beets, some curry flavored. You're switching them around all the time because you're inoculating with the good bacteria so that some of it will grab a hold in your gut and colonize and form little families of that good bacteria. That's the goal. So I was thrilled that she was going to do this. And her question was, but some of my friends have told me that if I use ancient grains like spelt or einkorn, they would be okay because the fermentation process would work. And I just had to smile. But it took me like a couple of weeks to respond because it was 6 hours of accumulating all of my research that I've been saving over the years, pull it all together, read the article, get the bullet points, pull them on an email, organize the email, then write it as like a message, "Dear Dr. Frederica," and blah, 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 blah. The bottom line is there is one study and only one study in the entire English language that I've ever been able to find that shows that, yeah, if you do this, you break down the proteins of wheat. There's no evidence that it activates the immune system at all. But there's only one study on that. Many other studies have shown it helps. Yeah, it helps a little bit, but it doesn't stop the immune response. Many studies have shown that. Every study has shown that except for one. And in that one study, they made sourdough bread, but they used 6 different strains of Lactobacillus san franciscus, 6 strains of it. Other studies, they use 1 strain or maybe 2. And yeah, we get some benefit, but still there's an immune response. But when they did 6 strains, there was no increase in antibodies to transglutaminase. That's the marker for celiac. And these were all celiacs who had been gluten-free for at least 5 years, who were in this study. There's no evidence of endomysial antibodies being increased, no evidence of increased intraepithelial lymphocytes inside the gut, meaning no evidence of increased inflammation in the gut, and no evidence of the villi wearing down. But it took 6 strains of lactobacillus to accomplish that. And that's not commercially viable. So the letter that I sent to Dr. Frederica, I said, yeah, it's very possible, but it's going to take us months and months and months to figure out how to do it safely. Meaning we have to talk to the authors of that study. They're in Italy, and they use the 6 strains of Lactobacillus san franciscus. And why didn't that go anywhere? And I think I know why. I think it's too expensive and it takes too long. That it took 48 hours of the sourdough process fermenting. And then when they baked that bread, no evidence that it offended the highly sensitive celiac group at all. So yes, it is possible. No, it's not realistic yet, until we figure out how to reproduce what they did in that study on a larger scale basis. You know, I don't know, most of you don't know that I was a baker. 1972 to 1975, around there, I think it was 74, 75. I was a baker in a health food restaurant making 48 loaves a day of the very best bread. And we didn't use any yeast, baker's yeast. It was a natural fermentation for 24 hours. And it was a destination bread. People would drive to the restaurant to buy a loaf of the bread. It was really good. But I was a baker, of all people. But the fermentation process in this study that I'm referring to was 48 hours. So one of my goals this year, Marzi and I and Gio are going to the Swiss Mountain Clinic in a couple of months, and they're looking forward to us coming, as I am, and going there. But is to work with Dr. Frederica, and let's work on the recipe to reproduce this bread that they did in the study, because that's the only safe one that's ever been shown to be safe, the only one. So I sent that off to her yesterday, and she responded with, "Oh my goodness, this is more information than I ever thought I'd get." But you know, so we're good, and one of our goals is to produce a delicious sourdough and then have a recipe. And I don't know how long it'll take, you know, but we'll start that process this summer. So the answer to the einkorn flour one is no. No, you can't do sourdough with einkorn because you'll just activate that immune response. Question number 2, what is your take on Ezekiel bread? I'm gluten sensitive and sometimes miss the taste and texture of a good slice of bread, as do I. This program was so very helpful in so many ways. I've learned much and I'm still learning. Thank you and Jenny for your excellent information and help and caring. You guys rock. Thank you, Joanne. Very kind of you. Thank you so much. Oh, wait, I'm looking at the phone. I have to look at you. Thank you, Joanne. It's very kind. But unfortunately, it's the same with Ezekiel bread. It has, I believe it has a little fermentation to it. Maybe they use baker's yeast, but there's no study with baker's yeast that says it reduces the immune response at all. And Ezekiel bread does not reduce the immune response at all. You have to understand that the mechanism that's causing the inflammation in your gut from wheat, there's 2 responses that occur. One, well, let me back up. You have sentries standing guard. inside the first part of the small intestine. So when food comes out of the stomach, those sentries are looking at everything that's coming through. I think of the soldiers at Buckingham Palace with those big hats, standing as stiff as can be. They look like they're harmless, just almost like toys, but don't mess with those guys. And that's toll-like receptor 4 sitting inside the first part of the small intestine. They're dormant, they don't do anything but they're scanning and they're looking for any threat, any potential threat. When they see a threat, they get activated immediately within 5 minutes. You see within 5 minutes of bread getting into the small intestine that there's an increase in the protein zonulin, which is what causes leaky gut. So you get an increase in leaky gut. Why? Because leaky gut is designed to save your life. That it's the life-saving mechanism from our ancestors 5,000 years ago, 10,000 years ago, that when they find something to eat, the first thing they do is they sniff it, then they nibble at it, then they eat it. And if they couldn't identify a threat, but if there was bad bacteria in that food, when that bacteria comes out of the stomach into the first part of the intestines, that's where the sentries are standing guard. And they see it, and then two things happen. They activate zonulin and the leaky gut. So water comes out of the gut into the center of the gut where that food is to wash it out with the poop. Think of mud on your driveway. You turn on the garden hose to rinse off the driveway. But if there's mud that's caked on the driveway, you have to put your thumb over the opening of the hose to get a spray, and you spray the driveway and it breaks up the mud, right? Leaky gut is like your thumb over the hose to get a spray to wash this out. Why? Because toll-like receptor 4 sees the proteins of wheat to look very close to identical to bad bugs. That the proteins of wheat, called the peptides of poorly digested wheat, those peptides have a very, very similar amino acid sequence, meaning the bricks on the wall look the same as the bricks that are a real problem, a bad bug. So gluten is misinterpreted as a harmful component of a bug. So the first thing that happens when wheat comes out of the stomach is it activates zonulin, so you get leaky gut. And the second thing is it activates the major amplifier of inflammation called NF-kappa B. And now you get all this inflammatory cytokines in the gut to kill the bug. So you're trying to wash it out, plus you're bringing in more soldiers right away to kill the bug. And this is a life-saving mechanism we inherited from our ancestors, because wheat is misinterpreted as a harmful component of a microorganism. It's the bottom line. And there are many studies on this. You can't argue with this. The only people that argue are those that have their heads in dark places and don't want to accept what the science tells us. So you just have to read the science. And if you're in the class, you've seen the studies and you understand that. But for those guests that are here, this is probably new information for you. So the answer to the question, unfortunately, Joanne, is no on the Ezekiel bread. I've recently been diagnosed with inflammatory bowel disease, specifically microscopic collagenous colitis, and I've not had a gluten sensitivity test. I'm eating sourdough occasionally. Is that good enough? Well, we've already answered that. Or should I get a gluten sensitivity test? I've been told that I have to eat wheat for a while in order to have a gluten test. Yeah, that's another historic misconception. You don't need to eat wheat for a while. Just do the wheat Zoomer. We'll put the link here for the wheat Zoomer test. Download the information, take it to your doctor, ask them to order this test for you. It's the most accurate test in the Western world. I've not been to Japan or China in many, many years, so I don't know what their labs are offering. But in the Western world, I can tell you, because I teach all over the world, there's no lab that has a test anywhere near close to the wheat Zoomer. And that's the test you want to do. And you do not need to do a gluten challenge. Do not worry about that. The test will be very accurate without a gluten challenge. Hello, my 2 kids have genes positive. Is it best for them to stop eating gluten? Really good question. And the genetic vulnerability, somewhere now, depending on what culture you're in, somewhere between 35 and 44% of the population has the genes for celiac disease and the genes for wheat sensitivity. 35 to 44%. That's not quite half, but pretty close. But 1 to 4% of the population gets celiac disease. Well, wait a minute. I've got the genes, but I don't have the disease. Right. Well, am I vulnerable to the disease? Absolutely. The genes tell you it's the weak link in your chain. That's all the genes tell you. And the way to use that information of what the genes are telling you, let's see if I can stabilize this microphone so it's not bouncing around. See if that does it. I get okay, yeah, that'll help. What the genes tell you is, hey, this is a weak link in your chain. You better watch it. And so how do you act with your children? What do you do? What are the action steps that you do if your kids have? That's a really good question. Thank you for being such a concerned parent. That's really wonderful to see. So what do you do? Those that have the gene but do not have celiac disease, what happened? They crossed the line of tolerance. At some point, and I'm going to date myself here, and it probably won't make any sense to most of you, but one of the cartoons I watched all the time growing up, of course, was Popeye. And when Popeye got pushed and pushed and pushed and pushed until he couldn't be pushed further, he said, I've stand all I can stand, and I can't stand no more. And he grabs his can of spinach and he squeezes it, and the spinach comes up in the air and into his mouth. And when he swallows the spinach, his biceps all of a sudden start bulging, and then he goes to save the day, whatever it should be. When you lose, Popeye lost tolerance to whatever the offensive agent was coming in. When you lose tolerance, how do you know when you lose tolerance? It's that billboard I showed you. We are being attacked. Defend, defend, defend. Meaning, when your immune system gets activated to fight wheat, that's when you've crossed the line of tolerance. So ideally, we don't want to throw gasoline on the fire because you're just pulling on the chain. But realistically, you want to monitor your kids. You do the wheat zoomer test. And with that test, you don't have to even do the blood draw. You can do a finger prick, put on a slide or on a card. That's all it takes. And it's extremely accurate. And if it comes back negative, your children have not crossed the line of tolerance. And so there is no rationale to urge you to not give them gluten. You can say, well, it's smart and they'll cross the line of tolerance somewhere, most likely. And I would say almost definitely, they will cross the line of tolerance. And if you have the environmental setup, meaning the family is all gluten-free, and we talk about it, and when the kids go to a party, you make some gluten-free muffins, and there's great recipes in my cookbooks, but you make gluten-free muffins and you bring them and give them to the mom at the party, so they give them to your kids and your kids know to eat those. You set up that kind of a lifestyle, that's the ideal. But if the wheat zoomer comes back negative, there's no mandatory reason why you have to make them gluten-free. You certainly will prevent problems down the road because it's almost guaranteed they will cross that line of tolerance. And while they're still under your umbrella and they can learn the lifestyle of gluten-free, that's going to be better. And if they If their test comes back negative, you can be gluten-free in the house. And if they go to somebody's party, they can try the cake and see how they feel afterwards, and you don't have to be fanatical. You have to be fanatical when they've crossed the line of tolerance and the immune system is fighting wheat, because now there's no question they're going to develop autoimmune diseases, not just celiac, other autoimmune diseases when you cross the line of tolerance. So that's the way that I would respond if my child came back positive to the genes for celiac disease. I'd make it a whole family affair and be a gluten-free house. And when they went out, if their test comes back negative, when they go out, if they had a little wheat, okay, whatever. But then I'd check them at least once a year to confirm that they're still not crossing that line of tolerance. Next, someone said, I'm happy to provide a testimonial. Thank you so much. And there was not a name that was given to me with that, but thank you. And we would appreciate that. It really helps when people are thinking about, well, is this a valid course, or is this going to help? If you can share your experience, that's just gold and really helps people. I kind of think of it like, I'd love to go through a toll booth, and when I'm renting cars, because I teach in different cities, and let's see, I'm going to Denver to rent a car in 2 weeks, and then I go to San Diego to rent a car in 3 weeks, and then I go to Phoenix to rent a car in about 7 weeks. I rent a lot of cars, right? And they don't have the pass for the tolls. So I have to stop at the toll booths a lot. And I always, no, not always, but most of the time, when I give her some money, I say, if it's like 40 cents for the toll, I'll give her $1 and I'll say, use it for the car behind me. And they look at me and I say, tell them I said to have a happy day. And then I drive away, right? So when you give a testimonial, it's like paying for the toll for the car behind you in the toll booth, right? It's like, what? It just helps that person have a little bit of a better day. So thank you for the offer. Next question. If dark chocolate must be avoided because of molecular mimicry, what can I substitute for the energy and sense of well-being that the dark chocolate gives? I have tried it, giving it up many times, but have failed. I have non-celiac gluten sensitivity, plus small intestinal bacterial overgrowth, history of Hashimoto's, osteoporosis, diagnosed Marfan's, and heavy metals. That's a really good question, and good for you for having such clarity of where the issues are. With a history of Hashimoto's, I assume that you're putting that into remission by all the work that you're doing. And make sure you retest that the heavy metals are gone after you finish your detox program, because it may be too soon to stop. Some doctors say, well, you've done it for 6 months, that's enough. Well, how do you know? How do you know? Some people need to do heavy metal detox for 2 years, that there's so much inside of them. So just make sure you retest when you're fighting bacteria, retest if the antibodies are gone to that bacteria. If you're fighting heavy metals, retest that the antibodies are gone for the heavy metals. Just retest. So with dark chocolate, it's not a common food for molecular mimicry. It may be a blood sugar trigger, but there's nothing like dark chocolate. My recommendation is that every human on the planet has dark chocolate daily, and that usually puts a smile on people's faces. But you get the very best dark chocolate you can, the very highest quality, highest percentage, and you have a square. And you put the square on your tongue. Don't let it touch your teeth. Meaning, don't chew it. Don't chew it up and swallow it. Let it dissolve in your mouth. And it takes about 2 to 3 minutes for a square to dissolve in your mouth. And you're saturating your taste buds with dark chocolate. So the taste buds are sending the message to the oral thalamic tract in the brain chocolate's here. Chocolate. And you start making the endorphins and the enkephalins that are 200 times more powerful than morphine. They're the feel-good hormones. And they start being produced almost immediately when the taste is going up to the brain. When you swallow, imagine how much of that gets to your brain. It's not very much, right? And plus, you may alter your gut microbiota. You might cause some inflammation if you have a sensitivity to it. So I would first suggest, if you've not tested and confirmed that you have elevated antibodies to dark chocolate, not milk chocolate. Milk chocolate is a problem for everybody. But dark chocolate, I would run a test with Vibrant. One of their tests, one of their Zoomers looks at dark chocolate. And if it comes back negative, just have a square a day, every day, but just have a square. Don't let it touch your teeth. And then you're going to bypass the impact on the microbiome and the impact on the gut, which may be where, if there was a sensitivity reaction, that may be where it was coming from. Okay. Next, there's a space here and it says connection to brain fog, constipation, sinusitis, skin rash. Seems like gluten products are so addictive that it's almost impossible to stop eating them. That's really true. That's really true. One of the things that helps with the addiction to gluten is to make sure that your blood sugar stays stable. And the way you do that's really easy now. It's really easy. You just wear a patch on your arm. Kind of looks like a nicotine patch. And it connects to your phone by Bluetooth, and it tells you what your blood sugar is right now. And I think they last about 2 weeks on your arm. You can shower with them and all of that. So when you eat a meal, just before you start eating, what's my blood sugar? And then you eat the meal. And then right afterwards, what's my blood sugar? And an hour later, wow, look how much my blood sugar went up. But wait, that was just chicken and sweet potatoes. Wow. But my blood sugar went up to 190 or whatever it should be. It should never, ever be above 120 to 130, somewhere around there as a peak. Resting should be about 70 to 80. That's an ideal. But when you wear a constant glucose monitor, a CGM, just Google CGM, you'll find them now. And you don't need a doctor's prescription. When you wear it, you're getting real-time education about what your current lifestyle, your current choices, how they're impacting on your blood sugar. And for someone that has brain fog, constipation, sinusitis, skin rashes, and addiction to gluten, you want to learn, how do I keep my blood sugar stable? And that reduces those cravings quite a bit. The other thing you do for cravings is have more spicy foods. Use more natural spices, because spices activate the opiate receptors, which is what gluten does, which is why it's addictive for some people. Especially people who have to be aware of this are those that have elevated antibodies to gluteomorphins, one of the chunks of the protein in poorly digested wheat. If your test result comes back and it says you've got elevated antibodies to gluteomorphins, that's when we have the talk with the patient. Mrs. Patient, you're likely to have a harder time giving up wheat and you'll have cravings because it's stimulating your opiate receptors, just like opium or heroin or cocaine. But our opiate receptors are throughout the body. They're a really important part of what's called the endocannabinoid system. And CBD is effective to help that. Low-dose naltrexone is effective to help that, to stabilize your opiate receptors so that when you stop stimulating them with gluten or the other peptides of wheat, when you're doing CBD or low-dose naltrexone, having some spicy foods once in a while, have a little chocolate melt in your mouth, not in your hands. Oh, remember that commercial? The result is that usually those cravings go down pretty quickly. But the monkey wrench in all of that is fluctuating blood sugar. That's why you get a continuous glucose monitor, is to make sure your lifestyle, meaning the foods you choose, the timing that you eat, is keeping your blood sugar in a stable range throughout the day. That's a really important concept to understand. Okay, those are the questions from our students, and thank you so much, and thanks for the feedback. And anyone else in the class that's here, if you'd like to write a little testimonial, it would be like, paying the toll for the car behind you. That it's just going to help somebody maybe make that jump and say, well, I guess I'll give this a try and see how it is. Okay, let's look at what other questions we've got. Thank you, Peggy, for your comment about an explanation. Soli is here. Hi, Tom, and thank you for this Q&A. In Europe, we have a test called Prima Home Test, measures IgA and IgG, and it gives a result similar to a pregnancy test or COVID, the one stripe negative or two stripes positive. Does the wheat zoomer measure more than these two measures? That is IgA and IgG. Yes, good question. IgA, IgG, IgM, but it doesn't do it just for gliadin, which is what almost every lab exclusively, they just test for gliadin. Or if you're testing for celiac disease, you're testing for transglutaminase, IgA, IgG. But there's 62 different parts. See, think of proteins like a pearl necklace, and hydrochloric acid in your stomach undoes the clasp of the pearl necklace. Now you have a string of pearls, and it's the job of your enzymes to act like scissors to cut that pearl necklace into smaller and smaller and smaller pieces, clip, 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 until you're down to each pearl of the pearl necklace called an amino acid. And they get absorbed into the bloodstream, and they're the building blocks to build new brain cells and bone cells and muscle cells. The problem is that no human, without exception, no human can break down the proteins of wheat into each pearl of the pearl necklace. We don't have the ability to do that. No human. Let me say that a different way. No human. Well, I feel fine when I eat wheat. We'll put that on your tombstone. You have to understand that for every one person that feels bad when they eat wheat, they get gut symptoms. There are 8 people that don't feel bad, but they get brain symptoms or skin symptoms or joint symptoms or depression. But their gut feels fine. I don't feel bad when I eat wheat. And the next day you've got a seizure, or your child's got a seizure, because that's the weak link in their chain. No human can break this down. I'm sorry to be like that, but it's like people don't remember that they don't want to know this. So yeah, come over and say hello. I have very important visitors here. Gio is bringing me my coffee. So thank you, Gio. Thank you. Yeah. Oh yeah, okay. Gliadin, and they might test deamidated gliadin. That's it. But wait, there's 62. They're using, I don't want to be disrespectful, but ancient technology in laboratory medicine. The wheat zoomer looks at 26 different clumps of the pearl necklace, IgA, IgG, IgM. And the accuracy is off the charts. Off the charts. I mean, 97 to 99% accuracy. If you want to know if you can count on your test results, and this is what I challenge doctors to do, most of them won't do it because they don't want to spend the money. But I challenge them, when you do a blood draw for a patient in the office, take a second tube of blood out of that same blood draw. Label the second tube Joe Smith. and then send it to the lab with the patient's results the same, or the patient's blood the same day. Order the same test, but a different name, and don't tell the lab. And so the doctor has to pay for that second test because you can't bill insurance and you can't bill the patient. But when the results come back, you see your patient and Joe Smith. Well, I know it's the same blood, but wait, what? And you see sometimes very different results. And that then now you realize how inaccurate most laboratories are in their blood tests, because they're using technology from the 1980s and the 1990s. They're not using current technology. This current technology that the wheat zoomer is based on is called silicone chip technology. And Mayo Clinic wrote the first paper that I saw, now there's many papers on this, in January of 2016. And they said, it's a new era in laboratory medicine because the accuracy of this type of laboratory procedure is off the charts, 97 to 99%. No lab technology has ever been able to do that before, ever. And so I challenged doctors to do that. And I did that in my practice, and then I was so confused, I didn't know what to do after that. Did I want the patient to spend the money on the test, hoping that it would come back and show the problem so that it motivates them to give it up? Or do I not, because I don't know how accurate it is anymore? I mean, that was, I called it the conundrum of gluten sensitivity. You just don't know what to do. But now with this new laboratory technology in the last 6-7 years, it's a different world. So yes, it's a very different test than what you would get in Europe. Now, let me go to the question from one of our students here and find my glasses. Once one develops a sensitivity to gluten, can it be reversed if one avoids it for a while? No, it cannot, because it's a life-saving mechanism to fight wheat, because your sentry standing guard, toll-like receptor 4, thinks it's a component of a pathogen, a bad bug. And so it remembers. It produces something called memory B cells. Now, what's a memory B cell? And this is really important, and I'm glad that one of our students asked this question, because I don't think I talk about it in the course. I don't think I do. When you get a vaccination for measles, they give you a shot of the bug, measles. And it's designed to wake up your immune system. That's why they put aluminum in there, or mercury, that's so toxic, is so your immune system, whoa, what's that over there? Just in case it doesn't recognize the measles itself. It's called the adjuvant that's carried with the bad bug to wake up the immune system, to fight it. And so you start making, your brain says, whoa, what's this? Yo, general. And in your immune system, you've got Army, Air Force, Marine Corps generals sitting around with nothing to do. You general, you now are General Measles. Take care of this. General Measles builds an assembly line. The assembly line starts producing soldiers. The soldiers are called antibodies to measles. They're special forces. And they go out there in the bloodstream, once again, on the highway, everything's bouncing around in there, but they're going around with their high-powered rifles looking for measles from the shot. And when they see measles, they fire their chemical bullets to kill measles. General Measles is watching all of this. When General Measles sees, okay, all the bugs are gone, turn off the assembly line, he turns the switch off on the assembly line. You shouldn't have measles antibodies in your immune system or in your bloodstream right now. You shouldn't, unless you've been exposed, but you shouldn't. But General Measles is vigilant the rest of his life. He's called a memory B cell. And you're sitting on a plane and the guy behind you is coming from Mozambique and he coughs measles bugs into the air and you breathe them in. Now you've got measles bugs in your bloodstream, but General Measles, who's vigilant, just silent, but always watching, he sees there's a measles bug in there. He just has to flip the switch. And in a vaccination, it takes 3-4 weeks for the antibodies to get produced and destroy the measles bugs from the shot. But when you breathe it in from the guy from Mozambique, General Measles just flips the switch. And in a day to 2 days, you've got antibodies right now to attack that measles bug so that it can't grow and develop in your body. That's the job of a memory B cell. That's the basis of all vaccinations, childhood vaccinations, until this crazy world that we're in right now in the last few years, this utter nonsense, but we won't go there today. And your body produces memory B cells to protect you. Gluten is the wheat. Wheat is the only food that I can find the evidence that you produce memory B cells, because your gut thinks, toll-like receptor 4 thinks that's a bug. That's a bad bug. I'm not going to forget that one. And you make, when you cross the line of tolerance and you're making the antibodies, you make a memory B cell to that protein of wheat. And for the rest of your life, it's vigilant. So no, you can't have a little once in a while. This inaccurate information about low gluten diets or cheat days is just from doctors who don't know what they're talking about. They haven't had a chance to read the science. You have a morsel. You buy a bag of lentils. Tricia Thompson did a wonderful study last year. She's a registered dietitian. She's glutenfreewatchdog.com. You learn so much about contamination of food from her. She bought a number of bags of lentils and different types, and she opened them up on a cookie sheet, each bag on a cookie sheet, and she looked through them and she found 4 or 5 kernels of wheat in there. And that's all it takes is one kernel to activate the memory B cell, and you're then producing antibodies from 4 to 8 weeks. And if the weak link in your chain is your thyroid antibodies come back, your TPO antibodies come back. If the weak link in your chain is myelin, the saran wrap around your nerves, myelin antibodies come back, and that's MS. That's the mechanism of MS. So you have memory B cells to wheat. You cannot have a little, you can't be a little pregnant, you can't have a little wheat. I hope that was clear. If one has a gluten sensitivity and unknowingly consumes it, how long does it stay in your system? Well, the gluten doesn't stay very long, but the memory B cell gets activated and you have an inflammatory cascade for 4 to 8 weeks. Is it true that eating foods with gluten in Europe is different and does not affect people with sensitivities? No, yes, no, yes, yes, no. Yeah, it's true the wheat is different, but it does affect people. They just don't know it. And this is part of the summary I sent to Dr. Federica at Swiss Mountain Clinic yesterday, that when people have bloating and gas and gut pain from eating wheat, 1 out of 8 has that. But when they do, that's not from gluten. That's from another component of wheat called FODMAPs, fermentable carbohydrates, most of the time. When you read the papers on this, it's very clear. FODMAPs trigger abdominal complaints with wheat. Gluten triggers immune protective responses to wheat. And the wheat in Europe is much lower in FODMAPs. So you eat wheat in Europe and you don't get the gut response to it, but you still get the immune response. And the only way you know that, you do a test, you do the wheat zoomer, and I've had a few patients do this. You do the wheat zoomer, you got a problem. You follow our protocol, you do the gluten-free course, and you follow the protocol. 6 months, you feel great. 6 months later, you go back and do the wheat zoomer again. Now it's normal, congratulations. And it better be normal or really close to normal. Sometimes it takes people a year to get it to normal. But when you go back and it's normal, well, doc, that's great. Now we're going to Europe in a couple of weeks. Can I eat wheat? No, and I explain all this. But if they're resistant and they want to do it, okay, Mrs. Patient, we now know that your test result is normal. You don't have any antibodies to wheat. Your Hashimoto antibodies are in remission. You know, there's no thyroid autoimmune disease right now. You put in remission. Congratulations, high five, way to go. Now go to wheat. Now go to Europe if you want. Eat the wheat if you want, and because you likely won't get gut symptoms. Then come back and we'll do the test again. And every person that's done that, when their tests come back, the wheat antibodies are back, the autoimmune antibodies are back. Doesn't matter if it's their brain or their joints, if it's rheumatoid or their skin, their psoriasis has come back, even though they didn't feel bad when they ate the wheat, because the wheat in Europe is lower in FODMAPs. Okay. Barbara's on Zoom and said, I have Hashimoto's and thyroid problems and was told to avoid gluten. Wait. I'm not sure I answered all the questions. Oh, I did. Yeah. For Robin, she had can it be reversed if one develops a sensitivity? No, it can be put into remission, but it can't be reversed because you have memory B cells now. If one has a gluten sensitivity and only consumes it, how long does it stay in your system? 4 to 8 weeks. The gluten doesn't, but the immune response does. And there's a whole emergency program that you can do of things to take to shorten that time. Is it true that eating foods with gluten? Okay, we did that. Thank you. And I look forward to the upcoming gluten Q&A. Oh, thanks, Robin. Okay. Now, Barbara's on Zoom. I have Hashimoto's and thyroid problems and was told to avoid gluten. Do you agree, and why? Absolutely. And the godfather of autoimmune diseases, his name's Professor Yehuda Schonfeld. He's at Tel Aviv University in Israel, and their immune department is world renowned. 26 of the MDs who went there and got their PhD in immunology, 26, there are many, many more, but 26 of them now chair departments of immunology in medical schools and hospitals around the world. They're his students. This is the godfather. And he just published a paper last March, so it's almost a year ago now. Let me see if I can bring it up for you. Why don't I just show it to you? Because it's so remarkable when the godfather talks about autoimmune diseases and gluten. So I'm going to find that paper here, and I'm going to find it. I always have to think about what presentation did I put that slide in, right? And there are some slides that I use in many presentations. Let's see if this is where I'll find it. Let's see. So give me a moment here while I'm scrolling. Do I have it in this one? No, I didn't talk to that group of doctors. I was in San Diego last month. Okay, they didn't get it. What about, let's see, not that one. Let's try this one and see. Is it here? And bear with me while I find it's worth waiting for. And I'm scrolling. $1 million question. What theme song am I singing there with scrolling? If you answer it, you can put it into the chat if you know the answer, or on Facebook, you can put it there. If anybody gets it right, you get 15 minutes with me on the phone, right? So, because I don't think anybody will know. I'm dating myself, but I don't think anybody will know. Let's try this one, which I'm happy to talk to people anyway. And I know Anne just went, oh my God, what's he doing? What's he saying? So let's see though, if I can find it, because picture's worth 1,000 words. You know, when you see this one, it makes so much sense. There we go. Okay, got it. So let me pull this one. Now I need to share screen again. and share screen. And we'll go here. Oh, Virginia. Virginia got it. Michelle, no, unfortunately not. But Virginia did, and Chrissy did. All right, Chrissy and Virginia is from Rawhide. That's right. Clint Eastwood's first appearance on television was he was a cowboy in Rawhide. Oh, wait, there's another one here. M.E. Branham got it right also. So the three of you send a message to Ann, and Chrissy just sent a happy smile. Great. So send a message to Ann how to contact you, and we'll set something up.
Please just email Laura at theDr.com to set up 15 minutes with Dr. Tom.
Okay. Great, Ann. Thanks. Let's bypass Ann. Just say, Laura, hi. I'm one of the three that Dr. Tom said he'd give me 15 minutes. So when can we do that? All right, let's share screen now. And let me bring this one up to here. Well, I think that tells me the age of the group that we're in here. But it was Clint Eastwood's first appearance. So here's the article, and you see that the fourth author here, the one that holds the paper, is Professor Schoenfeld. Look at the title of the article. Gluten-free diet can ameliorate the symptoms of non-celiac autoimmune diseases. Non-celiac autoimmune diseases. And what he said was, despite the nutritional value of gluten-containing grains, gluten itself is not essential in the diet, and its biological value is not considered high. So they reviewed 83 articles on this topic, and they found that reduction in symptoms of autoimmune diseases occurred in 65% of the patients, and this was confirmed in 79% of the studies, meaning not every time, but more than half the time, people get better on a gluten-free diet. And the autoimmune diseases that included the highest patient number were psoriasis, 61% got better. Hashimoto's thyroid disease, 87% of people get better on a gluten-free diet. And inflammatory bowel diseases was 59%. Autoimmune thyroid disease was the most responsive to condition to, this is the godfather of autoimmune diseases that's talking now. And they did this drawing, which no one can see. So I typed in all of the different diseases that the orange boxes are telling us. And let's just go there and you can see it. Multiple sclerosis, antiphospholipid syndrome, a very common cause of unexplained miscarriages, autoimmune myocarditis, autoimmune pancreatitis, recurrent pericarditis, idiopathic dilated cardiomyopathy, and the list goes on and on and on. They all may get better on a gluten-free diet. So the answer to the question is yes, absolutely. If you have Hashimoto's, you want to first test, do the wheat zoomer, and put the link in here to the wheat zoomer so you can see what that test is. Robin's asking, can a gluten sensitivity be reversed if one avoids gluten for a while? No. You can put it in remission, yes, of course, but it doesn't go away. Cheryl's on Zoom. Hi, Dr. Tom. Thanks for all you do. Thank you. If you're doing gluten-free and have one exposure to gluten, how long does it take? Okay, we've got that one. It's 4 to 8 weeks. Peggy asked, do you feel parasites also cause leaky gut? Absolutely. It's not a feeling for me. You know, it's really commonly known in the literature when you read the science. Absolutely, that happens. Been gluten-free for almost 20 years, but do love jumping into lakes and rivers in Colorado. I understand the feeling. I'm looking forward to, I'm not jumping in the river, you know, but I'll jump on the slope in a couple of weeks. But I do understand that feeling. And the gut zoomer is the most comprehensive test I know of to check your gut. And do you have too many bad guys in there? Where do I request zoomer tests? Chiropractor, primary care physician, gastro doc, functional medicine doc, integrative medicine doc. I always recommend Peggy, no, not Peggy, Paula, that you download the information on my site, take it to your doctor and ask them to order the test. That's the only way they're going to learn, is if their patients request that, you know, let's walk this through together, doc. You know, Mayo Clinic says it's the best test in the world for wheat. Let's just do this together. And if they say no, then you can order the test on my site. That's why the link's there for you. Wheat Zoomer is blood only, yes, but you can do finger prick. My understanding is stool is best for gluten testing. Stool is a good test to see if you've been exposed to wheat, because a stool test or urine can look for peptides of wheat. They're not supposed to be in your body. You must have been exposed. But in terms of testing antibodies, that is archaic. The technology on that is old, and it's not very sensitive and not very specific, meaning that it's not correct. I don't know the numbers. My suspicion is it'd probably be 3 or 4 out of 10 times it's not correct. Stool test to check for a gluten sensitivity is a waste of time and a waste of money. Stool test to check for gluten exposure is a good test, because if they find the peptides in the stool, how'd they get in the stool? Well, it goes in one end and goes out the other. So you must have been exposed to it. Beverly, I have psoriasis for 43 years and I've been gluten-free for 5 years. And with your information, we're almost 90% clean with cleaning and personal products and using glass cleaners. In your opinion, should I get the Zoomer test and wheat Zoomer test? And what Zoomer test would you recommend? Psoriasis is getting worse. I'm 73. Would the Air Doctor help? Oh, the Air Doctor always helps. But yeah, you're missing something, and you want to know you're gluten-free. But that's what our course is for, Beverly, is because most people, there's a talk I'm doing this year called Unintended Sabotage, Increased Mortality on a Gluten-Free Diet. You do a gluten-free diet, and if you're eating gluten-free products, you're sabotaging yourself. Columbia University did the study. They sent 804 people out into the community with testing equipment for gluten. And they all went to gluten-free restaurants and they ordered off the gluten-free menu. And they found that 32% of everything on a gluten-free menu is not gluten-free. Well, wait, but it says it's gluten-free and it's on the menu. It's not gluten-free, sorry. So do the wheat Zoomer test so you can confirm that what you're doing is thoroughly working, because if it's not, then that low-grade systemic inflammation is continuing. And if your psoriasis is getting worse, you're missing something. You're really missing something. All right, folks, I've gone over the hour and it was fun. Thank you all so very much for being here. If you're not a part of our gluten-free course, please consider enrolling in it. And as always, if you're not happy, we'll give you your money back. I mean, it's not that much money, but I don't mean to minimize it, but it really is to get the education that you need. Thank you all so much. Have a wonderful day.